I'm Shanna, and I have had two anterior hip replacements, one on the left, one on the right. Unfortunately, I'm the expert. First things first, when you start having pain in your hip, you need to go see a doctor and possibly have an x ray, not a chiropractor, not a massage therapist. You need to go see a doctor. If you're not sure who to go to, just find a doctor on your health insurance plan. Just pick one. Do not put it off, do not wait. Here is why. If the doctor tells you that you need a hip replacement, that means it's not going to heal on its own and it's not going to feel better. They may offer or suggest some alternative treatment, PRP injection or stem cell. I've done both. These are typically not covered by your health insurance plan, and like 50-50 chance it might work. And if it does, it's temporary. So knowing that your hip is only going to get worse, it's not going to get better, here's a question for you. As you get older, do you think it's going to be easier or more difficult to recover from surgery? It's going to be more difficult. The longer you wait, the older you are before you have the hip replacement surgery, it's only going to get more difficult for you to recover. Also, the longer you wait to schedule your hip replacement surgery, the worse your hip is going to feel and the more pain you're going to be in, and the longer it's going to take for you to recover from surgery, and your recovery will be more difficult. Here's another fun fact. If you live in the United States, depending on where you live, it could take anywhere from 1 to 2 weeks to 1 to 2 months before you can even get in to get an appointment to see an orthopedic surgeon about your hip pain. Your surgeon has determined that you need a hip replacement. Your insurance still has to approve it, so you have to wait for that. It's likely that you will be required to go to your primary care physician. They will order blood work. They will also likely order an EKG. Probably have to have an MRI at another location. So that's 4 different appointments right there that you have to wait and go to before you can even have your surgery. So that's why it's imperative to go see a doctor as soon as you start experiencing hip pain, because if you do need a hip replacement, it's still going to take anywhere from 2 to 6 months before you can actually have the surgery done. Stop putting it off. Make the appointment.